Okay, so now we're going to go through the course wall together. So as you can see, here's the calendar of upcoming, just when things were posted, and then when you can start when things are due, although this is off, so I'm going to adjust that for you guys and make you a due date list because this class started August 8th. So let's go through the syllabus together. So you would go under content, which is here to the left, and this is going to show you all the information for the week. So here's the course overview. It talks about Nursing 492, Community Health Nursing 1. It provides a solid foundation in community and public health nursing concepts and interventions for individuals, families, and communities. And one thing I just want to talk about is we are really going to hone the difference between public health and community health, because there is a difference. We're going to talk about the various roles of nurses in this area, about primary, secondary, and tertiary prevention, and trust me, those types of prevention, you will need to understand how they work in every level of nursing, no matter where you go. So even if you're like, oh, I'm going to go into management, you will have to understand those terms. The impact of policy, economics, social issues, environment, and cultural concerns, and then health promotion and disease prevention. So here are the course objectives. We're going to examine the nursing roles to meet the health of individuals, families, communities, and populations. Explore historical, legal, social, and cultural, political, economic factors that influence health. We're going to talk about strategies that can be used by public and community health nurses to improve health status, predict trends in lifestyles, plan, analyze, implement, and evaluate public health surveillance and outbreak investigation, so it's known as epidemiology, and develop strategies to deliver nursing care in the prepared response recovery phase of disaster management. So required textbook, there's not a set text for this. Obviously you need to have your APA book. I am super strict with APA. So right away I'm going to tell you, do not use an APA generator unless it's the best APA generator that money can buy, and it will trick me from knowing that you're not using a generator, but pretty much I do. So I know all about the generators. I am been to school 4 times now, and I know all about APA. So make sure that you double check your citations against this, especially if you are using a non-journal article. Those tend to be the hardest for people, especially if you're using a website, which is not a certified journal article. If you're using a PDF from an organization, you need to really understand how to cite those things correctly and to do in-text citations. I'm going to show you a module that I developed on APA tips. And if I were you, I would watch all the videos on them and read all the articles on them, because I will deduct points. I want you guys to become good scholarly writers. It's going to be important in your nursing career, so make sure that you pay attention to these aspects. Now, from each module, there are going to be evidence-based journal articles, websites, and videos that are going to be used. Okay? So that's getting started. So here's our syllabus, and we'll open it up. This talks about the course again, the university mission and goals, our program goals, our professional standards, the Institute of Medicine's core competencies, which is patient-centered care, work in interdisciplinary teams, evidence-based practice, quality improvement, and informatics. We talked about our course goals, the different course materials, and then how each module is going to be broken down. Module 1 is aging bias. Module 2 is aging theories and spirituality. Module 3 is about prevention, screening, and vaccines. Module 4 is about mental health and aging. Module 5 is normative aging changes. Module 6 is being prepared, so that's where we're going to talk about disaster management. Module 7, lifestyle and health alterations in the aging population. And Module 8 is healthy aging and self-reflection. Okay. So that's a bit of the breakdown of how each module is going to go. And then here's some information on resources. So these are the university set resources. They're really helpful. They talk about abstracts. I encourage you to read this because sometimes papers, abstracts can be really distracting because they're not written correctly. Namely, when people talk about themselves in their paper saying like the writer will be doing this. I do not want to find that in your papers. I understand that this is baccalaureate level and there's a learning curve with your writing, but just keep that in mind. Don't mention yourself when you're trying to write an abstract. That's supposed to be a professional, objective piece. Now, if some assignments ask you to talk about your own practice, you obviously can refer to yourself. But if this is a professional paper or a paper that clearly asks for an objective point of view using evidence to support it, I expect you to write it in a professional voice, so don't use I or this writer, and your APA book talks about that thoroughly. There's information on creating a quality PowerPoint, sample paper from APA, typing template for APA papers without an abstract, with an abstract, how to use Turnitin, and then APA style guide. And so I guess since we're on this vein, I added a module on APA tips. And these are videos and one resource on how to quote and paraphrase. So basically how to use your resources. This is where people have the most trouble. So this first link is going to take you to Purdue OWL, and it talks about different areas on how to write correctly. And I want you guys to look up paraphrasing and direct quotation, okay? So you can go to research and citation, scroll down, APA guide, and you can search and put paraphrase, steps to effective paraphrasing. Okay, this is really important that you know how to do this because if you paraphrase incorrectly, it's considered plagiarism. And after a few times, you're going to end up getting in trouble for plagiarism if you don't do it correctly. All right, so here are videos on avoiding plagiarism, the differences between a paraphrase and a quotation and how to use each, how to paraphrase. This one's really important. When and how to properly use quotations, because there's nothing worse than you read a paper and quotations are just dropped randomly and not integrated into the paper properly. And then how to cite an APA, because that is my biggest pet peeve. When people do not use incite references correctly. So I expect your parentheses to always be inside the sentence. Do not do period, then citation, because that is wrong and it drives me nuts. So please read this. Please look up your APA book. So I hope by this you can tell that I'm crazy about APA. Okay, so Module 1 talks about aging bias, and as you can see, it talks about the course questions and answers. Here's module information. It's going to give you the assigned reading, an overview, the goals, the videos to watch, okay? And then it will talk about the module discussion question, and if you click on it, it's going to lead you to the discussion board, and you will start a new thread when you are writing your discussion board. You will reply to a thread when you are responding to a classmate. Here is the discussion board rubric for the bachelor's level. This is how I grade, and I will write feedback based on what I find here in the rubric, okay? So think about critical thinking. Make sure that you have full thought, insight, and analysis. Make sure that you are specific. And make sure that you find ideas and draw concepts and present them to me. Then after the discussion, there's going to be a, close this. sorry. Okay. There will be your Module 1 assignment, and you will upload it here. When you submit your assignment and to turn it in, it shows me plagiarism software. So you want to make sure that your work is less than 20% duplicated from other sources. And it links me to each source that you use. And so it will tell me if you are quoting and paraphrasing correctly. So don't just change a few words when you paraphrase. Please watch those videos. And when you click on the Module 1 assignment, it explains what each assignment is. As you can see here, this is the file naming that you have to do. So first initial, last name, and then -MO1. Okay, so that's each how each module breaks down. Okay, if I usually tend to add things to the modules, I will always point them out to you, but you will find them here under this board, and I will always list them as these are extras, or feel free to use this article as research, so that you can just enrich your writing and your reading. Okay. Okay, so the course starts August 8th, and all your discussion boards are due on Thursday nights. Your responses are due on Sunday, as the Sunday of the week of the course, and that is also when your assignments are due. So I will also put a breakdown of the due dates. Okay, so that is just an overview. Please note that you have a library that you should use. Libraries are awesome. The librarians are very helpful. They're going to help you research. I do expect you to use more than your textbook. Oh, there's no textbook in this class. That makes it even better. I expect you to use more than one reference, especially your writing assignments, and to learn how to research. That's a really important aspect of academia and nursing. Your writing center is there to help you hone your writing skills. If any of you want to move on to your master's, you need to become good writers. So start practicing getting your skill now, because you don't want to wait till then to learn how to write properly. And then, of course, the way you're going to be tested in this course is based on your writing. So it's very important that you know how to edit, you understand grammar, how to cite things in format, so that none of that is distracting to the actual content that you are writing. Okay, so anyway, that's kind of just a course overview. I'm really excited to teach you guys, and if you have any questions, you can call me. You can email me. Here is my information, my profile. That's me. And you can email me here. And if you want to call me, you can, or text me, and my number is 513-293-3142. I prefer text, to be honest, because I don't like to talk on the phone. All right, I look forward to working with all of you.